Hey, good afternoon, everyone. Thanks for being here. I'm Katie Earle. I'm the coordinator of our University Express program, and I'm joined here today with my colleague, Bill Daniels. Welcome, Bill.
Welcome. Thank you, Katie. Thanks for the invitation.
Of course, Bill, you're always welcome here. So before we get into Bill's talk today, everyone, I'll quickly go through our housekeeping because we have some new folks on, which is exciting. We are recording this session and I'll try to post it on our website in the near future. If you have any questions or comments today while we're talking with Bill, and we hope you have a lot of questions here, feel free to type those in our Q&A panel. So if you're new, your Q&A is located on the lower right-hand side of your computer screen. If you're on a laptop or desktop, just click on that to open it. You'll see your text box. Send your questions right to me, or Bill has his up as well. And if you're on a tablet or smartphone, touch your screen. That brings up your control panel. Then you'll see a circle with 3 dots and Q&A. Click on that and same thing. Then you'll find your text box. So we hope you get all your questions out that you never knew you had or that you were afraid to ask. So quickly, we'll thank our sponsors, which is our Department of Senior Services, Blue Cross Blue Shield of Western New York, Excelsior Orthopedics, and Wegmans for all their support. And do not hesitate to contact us at Senior Services, which is what Bill will talk about, but our general number is 858-8526. Now let's learn about our star of the show. Bill Daniels has been serving as the coordinator of the Insurance Outreach and Counseling Program since 2006. He is certified by New York State Office for the Aging as a health insurance counselor and has been counseling Medicare enrollees regarding health insurance options since 1995 through the Erie County Department of Senior Services Information and Assistance Unit, so he knows a little bit about what he's talking about. Bill, thank you for being here. Take it away.
Thank you. Thanks, Katie. That a lot of times when people become eligible for Medicare, they're overwhelmed. I'm 69. When I turned 65, I got a lot of mail from all these people that figured they had the best plan for me. At least they were going to relieve me of my responsibility of making my own decision. We don't do that here. My program is federally funded from this Administration for Community Living. It came about because it's so complicated. There's basic Medicare and there's Medicare Advantage, there's Medicaid. It gets overwhelming for a lot of people. So we're the ones that have nothing to sell you. I have a lot of volunteers that many of which have had problems in their own lives making decisions. They went through the training, became certified. So we're the folks out there not going to try to sell you anything. We're not going to tell you what's best for you. We will give you your options and you decide what's best for you at the current time. More problems I run into those is people that when they became eligible for Medicare bought the wrong insurance. They will go with something that a friend has taken, or they'll have brand loyalty. They stick with what they've had in the past. And they get real sick real fast, and all of a sudden, the needs aren't being met. Got a call a few minutes ago from a man who's now got cancer. The medicine is $24,000 a treatment. Okay, so it's a bit pricey for him. It's a bit pricey for a lot of people. So he bought a plan that was zero premium. Made sense at the time, but now it doesn't make sense anymore. So he called me to see how he can help get the medicine paid for. There's the original Medicare, which has been around since the Lyndon Baines Johnson Society. It has two parts to it originally. Part A, which is for hospitalization. Part B, which is for skilled care, doctors, etc. And Part D, which came around in 2006, and that is for prescription drugs that are not covered by A or B. There's about 48 different plans that just cover prescription drugs, and about 28 different plans under the Medicare Advantage model, where you get your doctors and your hospitals and your prescriptions all rolled into one. And that's in Erie County alone. So there's so many choices, it makes it difficult for a lot of people to decide. Most important thing is to try to project your future needs. So a lot of people call me, they were healthy one day, the next day they're sick. I had the same occurrence when I was 60. Healthy one night at a concert, next day I was in the emergency room. Tiny little kidney stone. and they're common this time of year, in the summer especially. So you can't assume you're going to be as healthy in your future years as you were in your past years. So if you're 65 years old now, don't assume you're going to be as healthy at 130 as you are today. So most people that call me, they bought the wrong insurance, or they just became eligible for Medicare and are overwhelmed. Man I was talking to recently, about 2 hours ago, has little choice. He's kind of locked into his plan, and he's got some very expensive medical costs. Sometimes the manufacturers will help you with the cost of your medicine. Most of the time, they will not, because they're in business to make money. So it's very complicated. It can be very overwhelming for a lot of people. So I'd like to open up the questions if you have any, because that way I'll be able to tune into the audience better. So let's see if we get some questions here, Katie.
All right, Bill. We don't have any yet, but you mentioned that it can be overwhelming. So while we're waiting for those to come in, can you maybe just break that down for us to step by step? What's your first step when you're about to pick a plan?
Well, first of all, you want to apply for Medicare Part A. If you've worked into the paid into Medicare for 10 years, or your spouse, Part A is there's no cost to you. Part B is optional. That's for doctors and other skill therapy. That currently costs $148.60 a month for most people. If they're low income, New York State will pay the premium for them. So that changes every year. But it's worth to give us a call to see if we might be able to help get that premium paid for you. Also, there's another program that just helps with prescriptions called the Extra Help. Again, that changes every year. So it's good to give us a call. As you call us, please give us a list of your medicine, so if we can help narrow things down, because it's just so overwhelming. Competition has been known to drive down the cost. And that's where they found pretty much with this. But realize that sometimes there's conflict of interest. Some of these insurance companies are owned by the manufacturers of medications. Sometimes work with certain pharmacies, and they'll co-brand with a certain pharmacy to lower the cost. Some of your pharmacies would be what they call a preferred pharmacy, as opposed to a standard. So if you go to a preferred pharmacy, it's going to cost you less money than if you went to a standard pharmacy. It's not that easy whatsoever. That's why this government service still exists. And I say we're the ones out there that are not trying to sell you anything.
Thank you, Bill. And you mentioned medication, and we have a couple questions about that. So we have somebody that's wondering, how do you find out what insurance will cover the medicine you're on? And then another is, how do I know if a prescription or service will be covered?
Okay, how do you know if it's going to be covered? I prefer to use the Medicare.gov website. So you just go to Medicare.gov and then it's find a plan. They'll ask you some questions about your income, and they'll ask you your zip code, so they'll know what's covered in Erie County, for example. Some plans are not good throughout the entire state. Some are only local. So they'll put your zip code in. They're also going to ask you to give you the opportunity to list your medicine. Always say yes, because of those many different plans, they don't all cover the same medicine. And the price can vary from plan to plan significantly, as well as the coverage for the prescriptions. But prescriptions are the big wild cannon out there right now. They're the ones that are really driving the cost. Also want to look into see if your doctors participate. Under original Medicare, you can go to any doctor who's going to participate in Medicare. But say like you went with these plans that are advertised often, the Medicare Advantage, they could have a network to choose from. and they'll only cover you out of network if you have an emergency or urgent care. Urgent being decided that if you don't get care right away, say like you have diabetes, then that could result in an emergency. That's considered urgent care. So I deal with too many people that got real sick real soon. You almost have to try to plan ahead what your needs are going to be. And you look at your past history. What's happened to you in the past? Might that happen again? Unfortunately, in this area, a great deal number of people have cancer, which is why we got Roswell Park and others that service people with cancer located here. And matter of fact, I get a lot of referrals from cancer, and they bought the wrong insurance. Just got off the phone with a man a little bit a while ago. Unfortunately for him, his cost for his medication is $24,000 a month, and his share is about 25%. Still a lot of money, and he's locked in. He's locked in, and he can switch in October for January. So it's going to be a big chunk for him. Sometimes you could change earlier if you have a special enrollment period. And if you call us, I'll try to get you into a special enrollment period that allows you to change much sooner than that. Because people do get sick quick, and it can be very expensive.
And
So
Bill,
we
when
do
you
it.
say, oh,
We
go ahead,
have
I'm
a
sorry.
comparison sheet here between all the plans that we issue. It's our famous yellow folder. Have you ever gotten this before? It says, collect and organize your important information about health insurance and Medicare prescription drug plan coverage. It's issued by my department. It's government funded. Erie County Department of Senior Services, Health Insurance Information Counseling Assistance Program. So if you will call me with a list of your medicine, I will give you all your options. I'll discuss the pros and cons of each approach. I do not recommend people only to have Medicare because there's no out-of-pocket cap for your Medicare. Number one reason people are in bankruptcy is due to medical expenses. So we do have a comparison here. Again, we don't get paid from the insurance company. We just get taxpayer supported, so we can be objective.
Thanks, Bill. We have somebody who's wondering, so when do you have to enroll in Medicare?
Well, there's an initial enrollment period, which is 3 months before your month of eligibility, a month of eligibility, and 3 months afterwards. So Part A is usually at no cost to people. If you've worked in and paid into the system for 10 years, Social Security is part of your Social Security tax. You pay like 1.3%, I'm sorry, 1.6% of your wages, and your employer matches it. So 3.2% goes to fund the Medicare program. And A makes sense if it's not going to cost you anything more because you already paid into it. Part B, you do not need to enroll at any time. Or Part D. However, you're better have other coverage. So if you're currently employed or your spouse isn't currently employed, you can enroll at any time as long as you're covered by active employment coverage. I ran into a guy last week. He lost his job 18 months ago. He cannot get Medicare Part B right now, and he's pretty sick. His employer did him a favor in a sense that he paid for his COBRA insurance for 18 months. So he never got Part B. If you do not get Part B in those first 7 months when you're eligible, and you're not covered by active insurance based upon employment, yours or your spouse's, then you have to wait to January 1st, March 31st of every year, and it's not effective until July of that year. So the man I was dealing with last week, he's stuck until next July 1st. So it's half is a kind of powerful word. You have the opportunity. And these are government subsidized programs. You pay for it with your tax dollars. So
What's the age, Bill? The age for the date of eligibility? How old?
you can get Medicare at any age if you are disabled. I was dealing with a 38-year-old woman. She's very sick and she's got Medicare. You can get Medicare if you have Lou Gehrig's disease or end-stage renal disease very quick, like almost immediately. If you're on Social Security disability, other than Lou Gehrig's disease or end-stage renal disease, then you have to wait 25 months. After 24 months on SS Social Security disability, they will let you know you're becoming eligible for Medicare. Medicare is pretty good coverage, compared to other stuff out there. You get A, B, and D if you're on Social Security disability under those, either one or more of those criteria. SSD for 24 going on 25 months, effective 25th month, or Lou Gehrig's disease or end-stage renal disease. Other than that, at the age of 65.
Thank you, Bill. Somebody is wondering, can a family have different insurances?
Yes, most definitely. You have to look at individuals' needs. So it's people have different prescriptions. Not all companies cover the same prescriptions, or they won't cover a certain prescription at all. So it's best to look for individual needs and again try to protect your future needs. Usually people are locked in unless you have a special enrollment period. And that's why if people found out what they bought, usually it's a low cost plan because they're healthy and all of a sudden they got sick. I try to get them something better coverage.
Thank you, Bill. This next question you kind of answered, but I still want to ask it in case there's anything else. This person says, I was lucky enough to retire from the county with fully paid medical. Which parts of Medicare am I required to enroll, and how early do I need to enroll before I turn 65?
What was the first part of the question, Katie?
It was, I was lucky enough to retire from the county with fully paid medical. Which parts of Medicare am I required to enroll, and how early do I need to enroll before I turn 65?
Okay, so you had group coverage based upon employment. So 3 months before month of eligibility, you would need to enroll in Medicare A and B. D is optional. You need to compare what you can get as a county retiree. Most people cannot get health insurance based upon previous employment. And county employees, it depends upon your union contract that was in effect. Last time I did survey, about 25% of people on Medicare can get something based upon previous employment. So you want to, I mean, the county is going to require you to take Part B. At least D is up to you. But your best bet is to check with personnel and look what your options are going to be.
Thanks, Bill. This next thing that I'm seeing is, what are the pros and cons of Medigap policies?
The pros, it depends upon the Medigap policy. The pros are you can go to any doctor anywhere that accepts Medicare. Most of your Medigap or Medicare supplemental will pick up the co-pays for Part B. So if you're on an infusion medication, which it could be for cancer, it could be for MS, which is unfortunately very common around here, Lou Gehrig's disease, those are 20% co-insurances. Your Medicare, Medigap, Medicare supplemental, most of the plans will pick those up. I do have a comparison between all the plans in this area and what they charge. They've been standard coverage since 1993. I've been doing this since a long time before then. So they changed it in 2006, but they will pick that up. And that is better coverage for people in those situations than it would be your Medicare Advantage. Your Medicare Advantage are lower premium. They're more popular in this area, People like zero premium, they like free, but it's at 20%. It costs them a great deal of money. So most of your Medigap, your Medicare supplemental will pick it up. The disadvantages is they cost money. A cheap plan is a very good plan. It picks up all your co-pays and deductibles after you pay a deductible of $203 for 2021. Everything else is paid. The drawback is the premium, and also it doesn't have some of the fringe benefits that the Medicare Advantage has. For example, it doesn't cover eyeglasses on a routine. They'll cover a pair of glasses after cataract. They don't cover hearing aids. They don't cover much in dental to speak of. So that's the disadvantages on the fringe things that are not originally in the law. You have to realize that social programs are very hard to get through Congress. Very hard indeed. You know, it's easier to get many other services than social programs. So it's a tight fight every year. You get people with diabetes that have shoes. I was dealing with a shoe store recently. They no longer take Medicare because Medicare was having a private company investigate all their claims, and it wasn't worth them fighting the denials. They just couldn't afford to do it. So these folks are getting paid to deny claims, to investigate every claim they could. So it's all based upon money.
Mhm.
It's all a matter of cost and keeping the cost down, and yet still provide reasonable service.
Thanks, Bill. The next thing here is the $148.60 under Part B covered and the medical plan you choose, like Advantage, Blue Cross, HMO? How does that work?
The 148.60 for 2021 is paid by most people. It's 25% of running the cost of the program, so that varies from year to year. It would only be covered under a program called the Medicare Savings Program, or if you're on Medicaid, Medicaid will pick it up too. So that for 2021, the cap is $1,469 net income. So you'd have to look at your gross income, and we have a worksheet here on it too, how to calculate it. And you would subtract not your Medicare Part B premium, not the student loans that you're still paying, not the alimony or child support. No, you got to use gross Social Security. And from that, you can subtract your Medigap, your supplemental policy premium. You can subtract some, perhaps, of your Medicare Part D premium. Anything above what they call benchmark, you can subtract to get your income under $1,469. I was dealing with a woman a few years ago. She's got MS, multiple sclerosis, and she's in her 50s. And she says, I just cannot afford my medicine. So we got her a supplemental plan to knock her income under the cap at that time. So that instead of paying $3,000 a month for her medicine, she was able to get New York State to pay for the Part B premium by picking up a supplemental policy that knocked her income down under the cap, and she got the extra help, and her medicine was at $3,000, and that was costing her $9. So there's ways of getting things done in most cases to help folks out.
Thanks, Bill. We have a question. Are Epic and Extra Help the same?
No, Epic is New York State elderly pharmaceutical insurance coverage. I remember when it started. It started back in '87 by a group called the Great Panthers that also were funded by the manufacturer of the medications. They had a vested interest, both groups. So Epic, you have to be age 65 or older, a New York State resident, because it's New York State funded, and your income for an individual has to be under $75,000 last year, or last year's income of $100,000 or less for a couple. It's a great program. back in 2006 when Medicare Part D came into existence. A lot of states dropped their Epic-like programs. Many states have a large number of elderly who do not have a prescription assistance program. We're lucky to have here in New York. The most you pay is $20 with Epic for your co-pays. The medication would have to be under a New York State rebate program. The pharmaceutical industry in this country is very profit driven, very complicated with the rebates and everything else that the average consumer doesn't know about. So that's your Epic program. It survived many hard times here in New York, budget wise. But except the most you pay is $20 for a 30-day supply. Your extra help is different. That's a federal program, and that there's an income and resource cap that changes from year to year. Unlike the Medicare Savings Program, where you can buy other insurance to drop your income down, and you cannot do that with the straight extra help. But if you have the Medicare Savings Program, paying your Part B premium, you get the full extra help. But they're two different things. There's federal assistance, one state.
Great. Thank you, Bill. Let's see here. We've got, if you and spouse decline Medicare coverage at 65 because spouse's employer provided is as good or better, what are the time and date requirements for enrolling in A, B, and D if spouse retires and or if spouse dies and surviving spouse loses coverage?
Okay, is this based upon retirement or active employment? So if it's active employment, you're allowed to 8 months to pick up. So your spouse now, they're actively employed, you've got 8 months to pick up the Part B at any time. Part D, there's quite a few special enrollments. That person to call me. Okay, if it's retirees coverage and you only have Part A, then most cases you're going to have to wait to January of the following year. January to March won't be effective until July. So I run into that way too often. The person only took Part A because they had decent coverage from their employer's group as a retiree.
All right, thanks, Bill. Will you give your phone number, please, or the phone number for you and Sue?
Yes, when you want me to give Sue's home phone number? Yeah, okay. I need her too much. Our general number is 858-7883. 858-7883. And my phone's ringing. It's been ringing all through this talk here. So
Well, we appreciate you giving us your time right now.
thanks for having me.
Absolutely. This is important stuff. And the next question I'm seeing is, can you explain how Medicare coverage works with hospital stay and nursing home?
Hospital stay and nursing home. So you need a 3-day hospital stay for Medicare to pay, and it has to be admittance. It cannot be there in the observational status. As the cost of Medicare has been increasing, they have people on what's known as observational status. From the patient's point of view, you think you're admitted, but you're not. So you need a 3-day prior hospital stay, not observational. It has to be that. And then Medicare will pay for 20 days in full. After the 20 days, and there's a copay up to an additional 80 days. So you get 100 days coverage, either full or partial. You have to meet the criteria, which means criteria being you need skilled care, like skilled nursing 7 days a week, or physical therapy, or occupational therapy, or speech therapy. That's covered on Medicare Part B. Some are covered under A, but majority is under B. It's a 3-day hospital stay that gets a lot of people because they didn't meet the criteria for the program.
All right. Thank you, Bill. We have somebody who's wondering what questions should we be asking HR departments prior to retirement?
First of all, you're going to ask, may I still have coverage once I retire? Most people don't do that. Most employers drop it. So if so, you need to ask them if they'll pay the Part B premium for you. Most will not, but no, you might get lucky. Um, you want to know if you get prescription coverage. I was doing with Westinghouse retirees, and basically they were getting maybe prescription coverage, but nothing else. It depends. Most people cannot get health insurance once they retire, with the exception if you're in a union. You know, those are the ones that are keeping it. But most people are not unionized, and they just end up losing the coverage. So, and then you want to compare you get from your former employer to what you get on the open market and the cost. Realize that the rates are based upon their experience. So if you're got an employer who's got an awful lot of claims, a lot of losses against it, there's a good chance that you're going to be paying more. And sometimes it's more than what you can be paying on the open market. So we part of our famous yellow packet, we do comparisons between the different plans, but we don't know what the employer is going to offer. So you'd have to do a line by line comparison. I do have a half dozen good volunteers that could sit down and discuss it with you as well.
Thanks, Bill.
So
Next, we have when might it be time to consider applying for Medicaid?
applying for Medicaid is when you have the medical needs and you meet the program criteria. Now, Medicaid's a program for the poor by design. So the income is very low as we speak, is what they allow you to live on. Um, income cap is very, very low, as is the resource cap. So it always pays last too. So you have got Medicare and some other insurance, they would pay first besides Medicaid. So it's based upon resources and income. Um, I know what this year's is. It's usually less than poverty level too. It's speculative on. If you are disabled, you can look into a supplemental needs trust that allows you more income to live on, but you must be disabled. And it's not the supplemental needs trust will not work for coverage in a facility, skilled nursing home, for example, only for community Medicaid. So it's based upon need. It doesn't cost anything to apply. We can help with applications. Independent Living Center can help with applications. They're good government funds to help with the applications as well. So it's based upon need and resources and income.
All right, thank you, Bill. All right, I'm seeing a couple more things here. This is what is the best plan if you have high prescription costs?
Well, it depends. You got to give us a call. We got to do a comparison. And it might be a combination. If you're eligible for EPIC, elderly pharmaceutical insurance coverage, they're going to pay second. You know, so and not all plans cover all medicine, and they vary. The man I dealt with earlier, one plan was $24,000 a month, the other was only $23,000 a month. Depends upon the plan. So that was for one medicine. Poor guy's got cancer. Healthy last year, not healthy this year. And he bought the wrong insurance. He didn't, it's hard to predict how sick you're going to be. So best bet is to call and do a comparison. Medicare can help too. They don't know the local plans very well. So they usually have people call us. They don't know the ins and outs of the Medicare Advantage. So they'll make a referral to us. And the thing is, if you get if your medicine's not covered by a particular plan, they have to give you a 30-day transition dosage. After 30 days, they won't cover it. They'll try to switch to something else on the formulary. The prescription manufacturers are the highest profit industry in this country. now. So and they do give away free medicine now and then, but that's not insurance, and they can stop that at any time. So you're not eligible for Epic, like the man I was just dealing with. That's one of the options I'm going to give him.
All right. Thanks, Bill.
Yeah, it's
Uh,
just not that simple.
Nope, that's why we have a whole unit devoted to helping
Yes,
people
yes,
walk through this.
a lot of staff too. Yeah.
We have someone wondering, can you help with billing questions?
Can I help with billing questions? It's best to talk to the insurance company. Technically, yes. I haven't done too much with it lately. Usually start with the provider and make sure they bill correctly. I would also talk to the insurance company and ask them to review it. That was a more popular question before 1993. Those that provide the service must bill Medicare or the Medicare Advantage for you, and they will give you an explanation of benefits as to why they paid and what they didn't pay. If you're not happy with it, you could always ask for a case review or appeal it, the denial. And if you usually have the doctor backing you, there's a good chance to get it overturned. It's very hard to challenge a copay. You have to know what you bought when you bought it. The easier thing to do is a billing issue that's a denial of care, denial of payment for care.
All right. Thank you, Bill.
Welcome.
Let's see. We're really making you think today. This person's wondering. This person's wondering what's the difference between HMO and PPO and what's the best?
What's the best? Your HMO, you must go to providers within their network. And again, this all boils down to cost. These companies get a set amount of money if you're sick or not, and they want to make money or they want to be able to keep in business. So they have the most control if you're under an HMO model because they say, this is a doctor, we've got 100,000 members, this is what we're going to pay you. Okay, we're going to pay you this amount of money. You're going to do practice medicine according to the way that we prescribe. They have doctors on staff. They determine what's reasonable customary medical care. They have the most control. Therefore, they can control the costs better than under the PPO model. The PPO model, preferred provider organization, allows you to go on a network. And because the insurance company doesn't have so much control, there's a good chance it's going to cost you more money, but it allows you more freedom. Freedom's not free. Okay? Company doesn't have much control. They'll pay the doctor customary and reasonable for a particular area where you receive care. And it's a good chance it's like I said, it's going to cost you more, but you do have that choice of going out of network. And there's another one in there called POS, point of service, that some of your HMO models will have a point of service aspect to it as well. That gives you a limited amount of out of network coverage. Freedom's not free. Nope, 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 nope. I wave my flag here. Freedom, freedom, ask any of that.
Thanks, Bill. I'm not seeing anything else come through, so let's just give it a second to see if anyone else has any questions. And you're looking at your Q&A panel up, right? It's at the right side of your screen.
Yes.
If you just want to skim through yours to make sure anything just got, oh, one came through, but I'll let you see if there's anything we've missed yet.
Okay.
Okay, so I'll read this one to you right now. Is it too late to buy long-term care insurance if you start after 65? How does one weigh the very high premiums against the cost of care if needed?
Long-term care insurance has only been around for paying for nursing home for long-term care. I assume it means custodial care. It's only been around since the mid-'80s. I remember when it came into existence. I was on a conference call recently, and they anticipate that the premiums are going to be going increase maybe 250%. New York State has what they call a partnership plan, that if you buy this partnership plan, you will then, once you're eligible for Medicare, you can be able to keep all your assets and still qualify for Medicaid. As we speak now, the Medicaid resource limit is 15,900. So you could be a millionaire if you got a partnership plan and still be able to keep your assets. It does not protect your income. As an industry, and I've talked to different agents and brokers, it's becoming harder and harder for them to sell a policy because the insurance company doesn't want to take the risk. It has to be underwritten. Like Medicare, which you would be eligible for as a benefit, long-term care insurance is not. You can look at your try to predict your future. I mean, do you smoke? You're much greater risk for becoming sick than if you don't. If you don't exercise, you're a bigger risk. There's a lot of factors out there to look into. The only thing I can say for sure, if you do not have any money to protect, don't even look at long-term care insurance. I've dealt with people that have bought it, and to save maybe 30 or 40,000 in assets, it's not worth it because the premiums get very expensive. Sometimes they have a non-forfeiture aspect to the premium, to the coverage. When they can't afford it, they'll get some of the money back, and assuming they haven't used it. That's complicated as well. Generally speaking, the average person in Erie County that ends up in a nursing home is a woman age 84 who is incontinent, confused, and crippled, does not have anyone to take care of her at home. And the average stay might be a year and a half. Now that's a vast generalization. The ratio in nursing home is 6 women to every man. Men die younger. Maybe his wife or daughter takes care of them. Women generally might have a daughter to take care of them, or a daughter-in-law. And those are the ones that usually provide the care. And, of course, we have a caregiver support center here as well for the county. But, look at your lifestyle, try to predict your future. The only thing you say for sure, if you don't have the assets protect, don't consider it. There's some attorneys out there, quite a few, that are making a good living off the Medicaid program by setting up trust. They're legal, but realize you don't get any choice of your care. Pretty much, if you're on Medicaid, you don't have much choice. You have to take the first bed available in 60 miles. My daughter's first a nurse when she first graduated from nursing school. She was working in a nursing home that was rated the lowest possible. There were maggots in the bedpan. The eggs were making the patients cry. Okay, and they were pretty much kind of abusive to the patients. But it still had a 1-star rating. Was still getting reimbursement by being paid for by Medicaid. Now, if you have long-term care insurance, you got much more freedom of choice. Or if you got money, you have more freedom of choice. That's the truth of it. It's all money driven. They got bills to pay too. So try to predict your needs. Look at your lifestyle. Look at your relatives. How long do they live? How long were they healthy? So, but most recent conference, they anticipate their premiums to be going up, and there's no guarantee that is affordable in the future.
Wow, thank you for that, Bill. This last question I'm seeing here is, what if you travel? What insurance options do you have?
If you travel, you're better off with a Medicare supplemental policy or a PPO, preferred provider model. As I mentioned earlier, the HMO, and I'm dealing with a guy who's coming up from Florida now. He's got an HMO in Florida. He's got stomach cancer. He's coming to New York State because he can get better care. And at least he thinks he can. Pretty much, we got one of the better care facilities in this area compared to other states. And they'll cover him too at the end of this month. Then they won't cover him. So if he had a PPO, he would have the option of getting care here at Roswell, or if you had a Medicare supplemental. Another woman coming up, she's on a feeding tube, she's only 64, coming up from South Carolina, coming up for the better care here. And same thing. Nice thing about the supplemental policies, they must sell you a policy regardless of your health condition. There is a penalty if you've only had Medicare in the last 2 to 6 months, they will not cover for you for pre-existing condition. So even if you had a Medicare Advantage, you've got something besides Medicare, or a veteran, you've had something besides Medicare, they will sell you one, and they cannot ask you about health conditions with a supplemental. So the supplementals have a premium that costs more than the others, but they're better at the major medical expenses than the Medicare Advantage.
All right, Bill. Thank you for that. It looked like you were going to add something. I'm sorry.
That's okay. I said a lot of people that are relatively good health will start and hope to stay that way, of course, with a Medicare Advantage because they like the low premiums. Sometimes if they have a special enrollment period, they can switch to a supplemental at any time in New York, regardless of age or condition, but you've had to have something else. And if you get a special enrollment period to switch, you can pick up a different drug plan and a supplemental.
All right. Thank you for that information, Bill. We'll just give it a couple more seconds here to see if anything else comes through. And while we're waiting, will you give the phone number for your department again, please?
Yes, it's 858-7883.
Okay. I'm not seeing anything else. Do you want to skim your Q&A panel quick just to make sure we didn't miss anything?
Says, how do you get Medicare number?
Hmm.
They ask about the number on their card, Medicare account. So that's, you apply through Social Security Administration for Medicare. If you want to call Medicare directly, the number is 1-800-633-4227. So again, 1-800-633-4227 is the general number for Medicare. And if it's a Medicare number, it's Social Security Administration does the application. See it there. Yeah, I get more calls from people that has insurance based upon retirement and the spouse. City of Buffalo, for example, it doesn't require Part B for the retirees, and the retiree would pass away and their spouse is kind of stuck. So how can we get written information from your office? Give us a call. We'll send it to you. 858-7883. Easy.
All right. Thanks, Bill. It sounds like we have solved all of the health insurance questions today in
No, we
49
haven't,
minutes.
Katie. We haven't even touched them.
I know we haven't. I'm just messing, but I appreciate you for doing this with us and for sharing your knowledge and showing people that our office is a resource. That's really wonderful. And we hope you take advantage of us because we work for you.
Yes. Thanks, Katie. Thanks for the opportunity to address your audience. Appreciate it.
Of course, Bill. Thank you. Oh, thank you. Great information. Thank you, Bill. So we'll end on that. Everyone have a great day. And Bill, I'll come over to debrief.